Hello, everyone. It's Michael Jones, president of the Medical Exercise Training Institute. And I know for most of you out there that are doing medical exercise or medical fitness, the idea of dealing with an insurance carrier is something that you just don't want to deal with. Well, folks, we started the Medical Exercise Specialist back in July of 1994. And I can tell you over the last 32 years, we've seen more and more medical exercise professionals receiving direct insurance reimbursement from insurance carriers. And it does happen, and it is 100% legal. But one of the key things is making sure that the services are medically necessary. So I'm here today just to kind of go over a different option that you can use that involves the insurance carrier, but the client is going to pay you, and the client then will get reimbursed with the documentation you provide to them. But it requires you get a referral from the physician, an MD or a DO, that clearly indicates the client is in need of medical exercise training services or functional conditioning services. That referral should not say anything about physical therapy. If it's a physical therapy referral, the client needs physical therapy. Let me say one thing. When we started this back in 1994, as a physical therapist, we wanted to find a way of transitioning our patients safely out of PT settings into fitness and exercise settings. So that idea of understanding the scope of practice is vitally important. You should not, as a medical exercise professional, be working with clients that are immediately post-op, have acute injuries. That's the realm of the physical therapist, the physician. Once they've gotten to the point where they're medically stable, they've been discharged from physical therapy. Now, this is where you step in. And with that being said, let's talk about this idea of how you can deal with the insurance carrier where the client can pay you and the client can get reimbursed. And that is our Cash First Reimbursement Model. The idea here is that it's your MedX Pro's guide. This is what it will be, the MedX Pro guide to how you deal with providing superbills to the client that they can submit. But it's not just simply the superbill, it's also the documentation, including the letter of referral from the physician or the physician's referral with everything else you've done. So if you don't mind, hold tight, let's explain this a little bit. We know chasing insurance claims is a barrier for client care. It's a barrier for healthcare. It's a barrier for everyone in the healthcare system now. And I know for the medical exercise and medical fitness professionals, as a non-licensed provider, it's even a greater headache. But we have found insurance carriers will reimburse if there truly is a need, particularly if this client has undergone surgery, they have significant limitations in function, and it's clearly seen that after physical therapy is done, the client needs ongoing exercise. Now, let me make sure you understand. You probably won't have any success with any type of reimbursement, whether it's the client getting reimbursed or you getting reimbursed directly if you're dealing with Medicare, Medicaid, or any other government-based insurance coverage. This is primarily for third-party carriers and in some instances, workman's comp. So let me explain this a little bit. We know that navigating the healthcare system feels like learning a foreign language. It is extremely difficult. You have to chase down insurance payments. It drains your time and your resources, and the clients desperately need affordable long-term care. Folks, most people don't realize this. When we started the medical exercise specialist certification back in 94, it was really for two reasons. The primary reason was we had a personal trainer that had mangled one of our post-operative patients after we had finished physical therapy. The second reason was we had one gentleman who was in a clinic who had sustained a back injury. He was working at one of the local universities. He was an engineer, and he was 62, 63. He had 2 more years to retirement. And what happened with his back injury, the company wanted to retire him and put him out on disability, which meant he was only going to get 66% of his salary. He was married, and his granddaughter was living with him. And he told me, he said, Mike, I can't afford that. Is there anything I can do after physical therapy that before they completely retire me and they cut off physical therapy that I can continue to come in so that possibly I may be able to get back to my work level of physical capability? We set up the program for this gentleman. We only charged him $25 per session. And guess what? It worked, and it worked exceedingly well. I think one of the problems we're seeing now is medical exercise training has become something for the elite clients. It's a means of allowing medical exercise professionals to charge a higher rate than they did for personal training, which I get, but also we have to remember those people out there that really need the service and are in dire straits because they've sustained an injury. They may not be able to work at their full capacity, so we have to think about those. That's why we're going to go over this model where maybe the client can pay you and then maybe they can get reimbursed. Some percentage of what they paid you, that makes a huge difference. So this idea, clients desperately need that affordable long-term care, and we don't want the medical exercise professionals absorbing all of this cost. We want it to possibly be something that you can share with the client, and that's why we're going to go over this model. So we want you to be able to secure your revenue immediately, but with a client-submitted workflow. The client will pay you out of pocket upfront at the time of the services. You will provide them with a superbill and the clinical documentation, the documentation of what you've done. And folks, that becomes important. We found over the years that the documentation most of our medical exercise professionals and medical fitness professionals provide is really unprofessional. It is subpar, and it is greatly lacking in detail, and also lacking in explaining the functional improvement that you're seeing with the exercise program. It is not simply, I know the code, I submit it in the bill, I send them the exercise session, and it's a lot more than that. And then number 3, the client submits their packet, and that's the packet of information you provided them, including the referral from the physician, the super bills for each session, and the documentation for each session. They submit that to the insurance carrier, and they deal with the insurance carrier directly. And I can tell you this, folks, what I've learned over the last 32 years is the insurance carrier is going to deal much more readily with the client than they will deal with you. Now, there are 3 phases of this. First phase is you secure the medical referral from the doctor before the training begins. This becomes important. Client contacts you and says, hey, I want to come in and work with you. You now have to get the referral from the physician, an MD or a DO. It really can't come from the physical therapist. It could come from the chiropractor, but it must be a doctor that is licensed in the state to provide medical services. The insurance carrier pays if there's medical necessity, but they will never pay for general fitness. As soon as you call it personal training, general fitness, it's a done deal. They're not going to pay for it. Clients must obtain a physician's referral that explicitly says or requests medical exercise training. Crucial, never use the term physical therapy, which is outside your scope of practice as a medical exercise professional, which we've taught from day one that we offered the medical exercise specialist workshop back in the 1990s. The referral must also include a specific ICD-10 diagnostic code. For instance, here, for the total knee replacement, the diagnostic code is Z96.651. For gait abnormalities, it will be R26.89. You must get that from the physician. And folks, don't be concerned about asking the physician for that information. Everyone in the healthcare team, the nurses, the therapists, everyone must get that information from the licensed physician. So continuing on with phase 1, you also must be able to establish absolute financial clarity on day 1. Simple as this. Instruct the client to call their insurance carrier to verify their out-of-network benefits for medical exercise training. The insurance carrier probably won't know anything about medical exercise training per se, but they will say, you do have benefits for some rehabilitation services. Now, please make sure that you exhibit to the insurance carrier, whoever you're talking to, that you hold yourself out to them as a medical exercise professional and not a physical therapist. That is fraud if you don't do it, so make sure you're very clear to them on that. Make sure you also agree on a fee schedule immediately when you're dealing with the client. And with that agreement, the client is being responsible for paying you directly, and you're responsible for supplying them with the exact billing codes and the paperwork. Folks, it's not just about the billing codes, it's about the paperwork and documentation too. Phase number 2, you now have to translate the physical activity, physical movement into the language of the insurance carrier. You can't just simply say leg press, leg extension, how many sets and reps. The insurance carrier says, we need to know more than that. So if it isn't documented, it didn't happen. You must document everything in a professional manner. Start with your initial assessment and make sure you establish baselines for functional outcome measures. We've talked about these in previous podcasts and previous videos in our MedX Pro operating system. This is why we presented the system. You've got to have all your ducks in place, all your systems processes in place to now begin to deal with the insurance carrier so the client can get reimbursed. Make sure you have SMART goals, and with those SMART goals, short-term and long-term goals. Log every single session. document specific exercises, resistance levels, duration, the client's pain levels, and these notes are evidence required to support your CPT procedure codes. We'll talk about the procedure codes in a webinar we're going to do on March 19th, but we're not going to get into the procedure codes now, the CPT codes. Let's just get the idea of how you're going to use this Cash First Reimbursement Model to actually secure more clients and hopefully help them get reimbursement. Phase number 3, generate a clean itemized super bill at the end of the month. Now, I would even say at the end of each session, the end of every week, or the end of the month, whichever one works best for you. What does the client want? The client may say, I want to submit something after every session. Great. Every week, great. Every month, great. We just used a month as the guideline here. Make sure you include your business NPI number. You need to have an NPI number. We'll show you that in our webinar. We'll talk about the webinar in a few moments. You need to have an employee identification number, EIN number, and you also need to have the doctor's NPI number and also the diagnostic codes that the physician is giving the client based on their diagnosis, and itemized dates of service that are translated into CPT codes, such as the code for the assessment, the code for the therapeutic exercise, the code for neuromuscular education, and also therapeutic activities. Those are all now put into this super bill. And remember, it's a super bill, which is the itemized list of the services, but also the documentation. Package the evidence to guarantee client success. Folks, you're giving this information to the client and you want them to be successful. So be as detailed as you possibly can. Go in as much depth as you can without becoming overly detailed so that the client now can present this to the insurance carrier and the carrier can say, oh, this was necessary for your medical condition to help you improve your level of function, not to make you feel better or to lose weight or to trim down a little bit, but to help you now become more independently functional. Do not just hand over to the client a basic receipt. Provide a documented and a detailed reimbursement packet. Combine the clean super bill, copies of the daily session logs, and the 30-day progress reports. The progress reports are vitally important. And make sure they're detailed with measurements showing functional improvement. This comprehensive package bridges that gap between your medical diagnosis, the client's medical diagnosis, I should say, and your exercise interventions. Folks, you got to prove it to them. And I think a lot of times we don't want to prove things to the insurance carrier. Folks, the insurance carrier says there are a lot of people committing fraud. You've got to prove to me what you've done, and there's nothing wrong with that. Even physical therapists and physicians now have gotten to the point, I don't want to deal with the insurance carrier, but the insurance carrier has been defrauded so many times that they're now asking for more detail. Does it get ridiculous? Yes, no doubt about that. But it's a necessary evil, especially if you want to help your clients. Continue on with phase 3. Make sure that you're documenting with medical grade documentation and the results are such that the client can actually receive reimbursement. Insurance adjusters review meticulously these records and make sure they align with what they're seeing from the reports from the doctor, they're seeing with the reports that you're filing with regard to progress reports, and they're lining up and aligning with the diagnostic code and the CPT codes. The claim passes, if it does, which hopefully it will, and we cannot guarantee it will. It may only pass muster so the client gets 10% reimbursement. It may be 80%. It may be 100%. It just depends on the client's policy, the insurance adjuster, and folks, don't get frustrated if you go through this process and you get a low level of reimbursement or no reimbursement the first time. It doesn't mean give up. It just simply means learn from what happened. And you're going to learn from the EOBs. If the claim passes, the client will receive a EOB, an explanation of benefits. This explanation of benefits goes along with the reimbursement check and it tells specifically what the insurance carrier pays for. Even though the client is dealing with it, ask the client to give you a copy of that so you now understand what the insurance carrier reimbursed for. The client can, hopefully the client can afford continued care as a result of the documentation and the reimbursement packet you provided to the client. Now, make sure you understand you're getting your professional fee up front without chasing down a single insurance reimbursement claim, but you want to make sure that package you give to the client, the documentation you give to the client, and the super bills all are detailed enough that they can pass the muster and the scrutiny of the insurance carrier. Now, This will hopefully help you build a bulletproof medical exercise training practice. You've probably watched some of our other videos and you've heard me say, are you referral ready? That means you can take the referral in, you can manage that client coming in the door, so you have an onboarding process that is professional and systematic, and it's not haphazard and different for each client. But then along with that, you can communicate your findings back to the doctor, therapist, or chiropractor in a professional manner of documentation. That's referral ready. The next step is reimbursement ready, that you have all of the ongoing documentation. You can package that together in a reimbursement packet you can give the client either on a daily, weekly, or monthly basis that they can submit to the insurance carrier. And when the insurance carrier gets it, they look at it and this is professional. But it all starts with getting that referral from the physician that clearly says medical exercise training, functional conditioning. It cannot mention physical therapy. We talked about that earlier. Stay in your scope. Now, you're going to stop chasing insurance claims. It's going to empower your clients with the documentation they need so they can get reimbursed. Everybody wants to get reimbursed for services they're paying for. It'll secure some of your business revenue. And this reimbursement process, you're going to implement this Cash First Reimbursement Model as quickly as you possibly can. Once you institute this model, you're going to refine it. You're going to get better at it. You'll gradually start to understand which insurance carriers will work with you, which ones won't work with you or the client. And over time, you'll just learn more and more. Now, we put together a webinar for this because I know this is very complicated. The CPT codes, the ICD-10 codes. And I hear a lot of people say, Dr. Mike, what are the codes I need to use to bill? Folks, it doesn't work just that way. You just simply send the insurance carrier a bill with a code. If that happened, every doctor, therapist, chiropractor will be a billionaire. It doesn't work that way. You have to determine or show the medical necessity. And then along with that, the documentation, the necessary CPT codes, the ICD-10 codes, and then submit that to the insurance carrier. So we're going to have our first webinar. This will be Thursday, March 19th, 2 p.m. in the afternoon, okay? A time when most of you don't have clients. Clients are going to pick up around 4, 2 p.m. Eastern time. This is only a $97 webinar. It'll run about 2 hours. You can get a recording of it when you register, and we're going to help you understand this Cash First Reimbursement Model, what you need to provide, how you need to provide it, how you need to document it. We're even going to allow you to get a toolkit. When you register, you'll be able to download a toolkit, and that toolkit will have everything in it that you need to help your client secure reimbursement. We'll walk you through that step-by-step process. Now, this idea of bridging the gap with this Cash First Reimbursement Model webinar we've outlined here. It starts with the idea of post-rehab payment gap. There's a huge gap there. We're going to go over all the components of that. Then the solution is a Cash First workflow. We're going to walk you through that process. We're going to walk you through everything you need to give the client. Now, let me make sure you understand, this is not guaranteed. There's no guarantee dealing with an insurance carrier. I don't care if you're the greatest orthopedic surgeon in the world, the greatest neurologist in the world, greatest family practice doc in the world. There's no guarantee with an insurance carrier, even if you're an enrolled provider. But you learn with every situation that you encounter with the insurance carrier. You take that information back, you learn from it. You can always resubmit the claim or appeal. We'll even help you with that and explain that a little bit in this workshop. But I want to make sure you understand, none of this is guaranteed. Not one aspect of this is guaranteed, but it's something that you need to know. And tell your clients, yes, you're going to pay me for the services, but there's no guarantee that you'll get reimbursement. We found over the last 32 years that the client has the greater likelihood of getting reimbursed than you do as the medical exercise professional. So with that said, please, if you would, look down below this video. There should be a link to get registered for the webinar. I know for some of you, 2 p.m. In the afternoon Eastern time may conflict with some of your clients. If you register for the workshop, you will get a copy of the recording. You'll be able to download all the materials. And also with that, at a later date, we'll do a Q&A session to follow up with any questions that you have. So this is probably the best $97 that you're going to spend in 2026 with helping your clients secure reimbursement, you getting a better understanding of insurance reimbursement, more importantly, making your practice referral ready and reimbursement ready. So look me down below, get registered, or shoot me an email at drmike@postrehab.com. But this idea of you've got to start being able to deal with insurance carriers, whether it's you directly or helping your client do it. And we'll walk you through everything you need to tell the client, everything you need to do. But let me make sure again you understand, none of this is guaranteed that the client will get reimbursement. What we are advocating for is that you will get paid and you'll be able to give the client all the documentation they need, which will help the client. It will help you with your revenue. And if the client does get reimbursed, they will tell the physician or the therapist or the chiropractor, and that will help you in that regard. So thank you for watching. If you have any questions, email me at drmike@postrehab.com. Go down below. We're only taking 20 participants for this workshop on March 19th. And I think it's something that will be very helpful for you. So all the best in building your medical exercise training practice. And we look forward to seeing you in the workshop on March 19th. Take care.